What can therapists do to better help their clients? Recently, we set out to find the answer to this question. We asked therapists about things that they specifically do to help their clients. Some of these things included reading books about therapy, reading research in the field, and thinking about how to modify one's approach with certain clients. We also asked about how useful therapists found various parts of the Acorn toolkit, including how often they learned something useful for the treatment of their clients from the outcomes questionnaires. So what did we find? Therapists who learned something new from Acorn for at least half of their clients had a strong trend towards more improvement than their peers. This finding points to a connection between the client feedback gained and using it to change some aspect of treatment going forward. This echoes the findings of Norcross and Lambert. Practitioners are encouraged to routinely monitor patients' responses to the therapy relationship and ongoing treatment. Such monitoring leads to increased opportunities to repair alliance ruptures, improve the relationship, modify technical strategies, and avoid premature termination. What about external improvement activities? Did those help therapists become more effective? Surprisingly, the improvement activities that we asked about were not significantly associated with better outcomes in this sample. Acorn has the most positive impact on client outcomes when the therapist learns from the client's responses and uses that knowledge to impact the future course of treatment. What might this actually look like in practice? I'll show a few examples. It might be something as simple as noticing an outlier score that you didn't expect when you look over a client's form and then discussing that during the session. Or perhaps you notice an unexpected note in a client's clinical message. What about the client's graph? In this example, everything might look fine on the surface, but when we add in substance abuse, we see a distinct upward trend. If this is unexpected, it might be something worth discussing with this client. On this client, we see that the client's global distress has recently been trending back upwards. Perhaps the reduction in session frequency could be a factor. Keep in mind, the more cases in which you're able to gain insights, the better off your client's outcomes will be.